We're live.
Thank you and welcome to the 2:30 p.m. Public Works Committee meeting. I call this a meeting to order. Agenda item number 2, Sylvia Powell, are you here?
Yes, ma'am.
Come on up to the table. Reappointment to the Sales Tax Overview Committee, term expires December 31st, 2028. Attended 7 of 12 meetings representing Council District 2. We got a real chair.
I'm fine.
You're fine? Okay.
Fine.
All right. Thank you for
That's
coming.
Councilor Bush's ankle there. I'll
in-
sit in the short chair.
All right. In 2 minutes or less, tell us a little bit about yourself and why you'd like to continue serving on the Sales Tax Overview Committee.
I am a native Tulsan, born and raised here. I have always lived in District 2. No desire to live anywhere else. It's the best place to live.
So insulted over District 3 here.
Thank you. And anything else you want to share?
I have been on the Sales Tax Overview Committee, and I thoroughly enjoy it. I like to make sure and see that the city is using the tax money the way they're supposed to. That was one of my biggest things.
That's the whole purpose.
People always think, do they really use it like they're supposed to?
Now you can answer it.
I can say yes.
Yes, very
We
good.
toured the zoo yesterday
Okay.
and saw the construction that they're doing out there. It is going to be amazing. I can't wait to go back once it's done. I am a retired project coordinator in the oil and gas industry, which consisted of connecting natural gas from the wellhead to the main pipeline and everything in between from one step to the next. Also, I wrote legal contracts to purchase natural gas. And did that for a number of years and absolutely loved it.
Well, thank you for your willingness to serve. You certainly seem to be fully qualified. So.
Thank you.
All right, we will be voting on your additional appointment or your reappointment on April 1st at 5 o'clock. You can attend if you would like to have words, but it's not necessary. And thank you for your willingness to serve us.
Does anyone have any questions for me?
How long have you been serving on here?
I started serving, I believe, in 2019. The person that had the
Okay.
commission.
Oh, okay. And then
I
you
was
just-
like-
you
for
filled
someone
the
was like
seat.
19.
I
I
feel
know,
like-
it was like 19 something.
2019.
2019,
Yeah,
okay.
because the person that originally held this seat vacated,
And then
and
you filled
Counselor
that.
Q asked me to fill in.
Okay, great.
Thank you for your service.
Thank
Been a
you.
resource to me, for sure. Thank you.
Thank you.
Yeah, thank you, sir. Thank you all.
Thank you for
Agenda item
serving.
number 3, Joseph Paul Hassick.
I don't see Paul
Hassick, he's not here? Okay, maybe he'll come in. We can go back to him. Agenda item number 4, resolution authorizing payment of $61,000 to Joyce Moore, plaintiff, and Chris L. Knight, PC, attorney at law, Bewley Chiropractic, River West Medical Clinic, Tulsa Diagnostic Imaging, and Orthopedic and Spine Center from the sinking fund as a payment of a judgment and attorney fee award in case number CJ 2022-1821, Joyce Moore versus City of Tulsa et al. This carries the emergency clause. Hello.
Good afternoon, Councilors. Chad Becker from Treasury here, as always, to give you assurance that there is a sufficient cash balance in the sinking fund to pay this judgment ahead of the levy placement on the tax rolls. This judgment, in addition to the ones that will follow on the agenda, have been approved by the court and the mayor, and with council's approval, Finance will issue the payments to the claimants, and forward all the necessary paperwork to the county to levy repayment to the sinking fund over a 3-year period in the cases of these judgments. And Conlon from City Legal is here to discuss
Yes.
this first case.
Thank you, Chad. Good afternoon, councilors. Comrade Tacknell, City Legal. This was a motor vehicle accident that occurred at 91st and Memorial, where the officer rear-ended the plaintiff, so the city was at fault. And the $61,000 was a negotiated settlement we came to with the plaintiff and her attorney for medical bills, property damage, and lost wages.
Questions or comments? Thank you. Agenda item number 5, resolution authorizing, I'm sorry, is that right? Yeah. Agenda item number 5, resolution authorizing payment of $65,000 to Achilles Aponte, plaintiff, and Eisman Law Group, attorneys Peace Orthopedic, Tulsa Medical and Orthopedic Center, Diagnostic Imaging Solutions, Foundation Radiology, and Orthopedic and Spine Center from the sinking fund as a payment of a judgment and attorney fee award in case number CJ 2024-00056, Achilles Aponte versus City of Tulsa et al. Carries the emergency clause.
And, sorry, go ahead.
My part's the same.
Same, okay, so this is another motor vehicle accident, occurred near 51st and Yale Avenue. Again, this was a situation where the city employee rear-ended the plaintiff, and so it's, again, an admitted liability case, and the $65,000 was a negotiated settlement to cover the medical bills, pain and suffering, and lost wages.
Questions or comments? Thank you. Agenda item number 6, resolution authorizing payment of $150,000 to Karina Hopgood, plaintiff, and Griffin Reynolds and Associates, attorneys at law, Heritage Medical Clinic, OMSS, the Orthopedic Center, Bergman Chiropractic, and Perini Eye Care from the sinking fund as payment of a judgment and attorney fee award in case number CJ 2025-1532, Karina Hopgood versus City of Tulsa et al. This carries the emergency clause.
My portion's the same. We have Michelle McGrew from legal training to discuss this case.
Thank you. Good afternoon, council. This is another admitted liability case. There was a city employee from the Parks Department in an F-250 pickup truck, slid on the ice, was in a head-on collision with a plaintiff's vehicle. She had a collapsed lung and serious other injuries. She was in the hospital over 10 days. So we negotiated a settlement of amount of $150,000 to cover her medical bills, loss of earnings, and pain and suffering.
Questions or comments? Thank you. Resolution authorizing payment of $75,000 to Iglesia de Amor Ministries, Frazier Gonzalez and Iris Gonzalez plaintiffs, and Buxton Law Group, attorneys at law, from the sinking fund as a payment of a judgment and attorney fee award, case number CJ 2024-2143, Iglesia de Amor Ministries, Frazier Gonzalez and Iris Gonzalez versus City of Tulsa et al.
So this case was a water and sewer overflow.
Carries the emergency call, sorry.
I'm sorry.
Go ahead.
This case was a water and sewer overflow that occurred at the Iglesia de Amor Ministries Church. The church was purchased, or the building, the property was purchased in 2021. And in 2023, there were issues with the line, and there was an overflow into the church. Through the investigation, it was discovered that back in 1999, we did a rehabilitation process. And for some reason, the property's line was not connected to the city main line. And we didn't discover the issue until there was the overflow, and it caused the damage to the interior of the church. They had damages upwards of $50,000, so we came to a settlement for the $75,000 with the church and the minister for the church and the attorneys involved. So.
Questions or comments? Agenda item number 8, resolution authorizing a designated official to submit a joint application with Tulsa Public Schools for the Oklahoma Opioid Grant Award, finding extraordinary need to combat the opioid crisis in the city of Tulsa. This carries the emergency clause.
Hello, I am Natalie Russell. I am the opioid abatement response coordinator for the city of Tulsa. So this is an application for funding a 3-year cycle with the Oklahoma Attorney General opioid abatement grant. That's a mouthful. This application is asking for the continuation of some citywide efforts that are currently unfolding in Cycle 1 application. So that would include my efforts, the overdose response team efforts with the Tulsa Fire Department, school-based prevention, education, and intervention. And then on this application, we'll be adding Creoaks as a contractor to fulfill contingency management, MOUD, or medications for opioid use disorder, and executing substance use first aid community training. This application also contributes to achieving goals affiliated with 3 out of the 6 of the mayor's priorities: student outcomes, ending homelessness, and public safety.
Okay, what's the amount of the award? I don't see it in the agenda.
We are allowed to apply for up to $2.25 million over a 3-year term.
Okay.
We are asking for a total of $2.249. Just under.
Just under.
Just under.
Just, what is that, a penny or a thousand? All right, I get it. It makes sense. Any questions or comments?
What,
Hold on. Three hands went up. I'm gonna start down here and go right there. No one over here, right? Boom.
so was it Creos? Did you say Creos?
Creos, yes.
And how did they get that contract?
Good question. We made a selection based out of our, in the first cycle, we established a governance committee or governance board, and we opted to use the methamphetamine treatment continuum board. We kind of had to pivot a little bit. The original design of the governance board was to help us decide which direction we wanted to take the application each funding cycle. But the OAG moved up the funding portal, the application, opened up the application several months earlier than they had in the past. So I put out a call for proposals amongst that group because they are all leaders and experts in the substance use field. And we had 3 people submit proposals. I put together a committee to review those proposals. Myself, Robert Harmon with the county, he serves in the same capacity as me, and a few other of my coworkers in my department that currently coordinate grants.
Okay,
So they made the selection.
all right, thank you.
You're welcome.
Counselor Bellis?
I'm just curious, and this might be, I can always check with someone offline if this is like a deep dive question. How similar is this to some of our past applications for these dollars? Because, I know we've gone for some of these programs annually. Is this kind of asking to try to continue doing some existing work? Is it completely setting up something new? I just want to make sure I understand.
With Creox, it is something new.
Okay.
With the Tulsa Fire Department is continuation of the peer recovery support
Right.
services,
Okay.
but the addition of a paramedic.
Okay. Okay, thanks. That's helpful.
Counselor Dr. Wright?
Thank you. I just was wanting to go back to the 3 pillars that you mentioned. You said, what were the 3?
Student outcomes.
Student outcomes, homelessness, and what was the other one?
Public safety.
Public safety.
So student outcomes, we meet one of the goals of improving mental health outcomes for children and families through school-based prevention, education, and intervention. For ending homelessness, we contribute by creating a citywide system of mental health and substance use supports by prioritizing referrals from current Safe Move, Tulsa Partner, Tulsa Day Center, and Housing Solutions identified clients through an MOU with Creox to engage them with the MOUD and contingency management services.
Okay. And is that MOUD through the low barrier shelter, or is there another way that they're doing that?
They will, any clients that are identified through those agencies will have priority in accessing those services.
Okay, so it's system-wide. It's not
Right,
just
it is
through the
system-wide.
one
It
facility.
is not, yes.
Sorry, the winter shelter, I guess is what I was thinking of. I was just thinking, like, how would they access that? Okay.
So it'd be, any client identified through Safe Move Tulsa.
Through Safe Move, okay.
Are you done?
I think so. Oh, no, wait, I have a question about the, fire department. Two peer recovery support specialists and emergency medical technicians, that's item B on your project.
Yes.
Is that fully funded, or is this is this grant partially funding this
They would be fully funded for 2 years.
for 3 years? Okay, and right now, they don't exist, or they're on a different grant?
They exist. Right now, the 2 PRSSs were funded by Cycle 1. And
And that's like
The
350,000
paramedic
or
is-
something?
the paramedic is funded through another grant, but we
Okay.
need 2 paramedics in order for this project to go full-time.
So
right?
if we get these dollars, this would move that forward for three
Yes.
years. And then during that time, we find other grant monies and or general funds. Okay,
Yes.
got it. Thanks.
Counselor Gilbert?
Yeah, my questions were right along with Counselor Decker Wright's. We dedicated so much of this opioid money the last time for Safe Move to launch it, so I was just wanting to know how Safe Move was going to be a part of it, so.
Different opioid source.
Yes.
Oh, okay, okay, Good to know.
The city's direct.
gotcha.
I always have to put that caveat out there when I introduce myself and make sure everybody knows I only manage the state level opioid funding.
Ah, okay, okay, that's good to know, okay, thank you for that clarification.
But if we're starting new stuff with grant dollars, we as the people that have to find general funds at some point, I'm just keeping track. I mean, I guess we could always find a new grant source for these programs, but I think we need to be mindful that when we take these things on and if we get the dollars
Yeah.
and they are successful, which we want them to be, you know, there is always kind of a general fund to ask down when those dollars sunset.
The good news about the AG's opioid monies, 18 more years.
Yeah.
Yes.
So,
And technically, as a
We
government
have-
entity, we
we
could
have time
apply every
to-
year,
Yeah.
as long as
Like
it's a
them,
separate
really.
Maybe there'll be
project.
another.
They'd have to keep reapplying
They just
That-
keep on
and
yeah.
get selected.
Right.
right. And there's all of the stuff.
Is it from new stuff, or it's sustaining dollars too?
Both.
That's what she says.
Yeah, okay.
It is both,
That's
but
good.
we
We
have
have to
to
re-up every
clarify, if
time.
it's a sustaining product, if it's a sustaining application, you have to wait until that 3-year term ends, and then you can apply to sustain that effort.
Any other questions or comments? Thank you.
Thank you.
Agenda item number 9, resolution requesting quality event designation for the 2026 Black Wall Street Rally to be held May 14th through the 16th, 2026, identifying the city of Tulsa as the event's host community. This carries the emergency clause. Who's here from,
Brandon Jackson.
well, we normally have someone here from the chamber. No? Okay, go ahead.
Sometimes it's chamber honors depart, the managed entities.
Right.
I'll text her.
Okay, but they're not.
Go ahead.
Okay, go ahead.
Yeah.
Hello, good afternoon. I'm Brandon Jackson, and I'm a senior partner with the Black Wall Street Rally. We're motorcycle enthusiasts, cultural tourism events that's held every May in the Greenwood District. And this year we were ranked number 2 in USA Today for cultural events. And so we're trying to have the city of Tulsa be our host city, and I identified that at the state level. So I'm here to have the resolution pushed forward.
It's good to me.
Questions or comments?
A lot of motorcycles during that time.
My only comment is every year I get to hear people's like Google Maps read aloud so loudly from the motorcycles. It's one of the funniest things I hear every year, like clockwork.
Oh, really?
Because they'll play the
Turn
music
left.
really loud. I'm not complaining, it's a big fun event. But every time you can hear people's Google Maps going because they're visiting, and I just think it's really fun.
Giving directions.
Yeah,
Direction.
yeah, they're visiting, you can tell where they're going, you know where the party is because
My
you can hear
favorite
the
was
directions.
being in the hotel where they're all staying, because they all have like swag and, yeah, groups and.
Yeah, it's good
I
energy.
think I got recruited.
We
at the
appreciate
one
when everyone
I
comes
went
in the
to. It's
town.
awesome.
It looks like they also bring in quite a bit of.
Oh, it's a big
Everything.
event.
Oh, yeah.
It's a huge, yeah, it's really big.
Hotel and
Yeah.
food and everything.
Yeah.
Any other questions or comments?
If this is a push forward, when would it be at the council level?
It is on the agenda for next week, April 1st.
And if you approve it that night, how soon could we get a turnaround to get to the OTC?
To get what? The document?
It would go to the mayor's agenda the next Wednesday, so it
The
wouldn't.
next week, so the Wednesday after the 1st? So that's what, the 8th?
Do you have any other time
And then what?
concerns?
I don't know the logistics of the time frame after
When do
the
you need
mayor's
it?
agenda.
Last month, but last year we missed the deadline, so we've been pressing for this for the last 4 months.
Oh, wow.
And the lady who was doing it was out of town, and somebody was backfilling it, and just got here. So the tax commission doesn't give you a lot of support, so, they.
So you need this document to provide to who?
The Oklahoma Tax Commission,
Okay.
By when?
He said
I
last
know,
month.
but really,
Yesterday?
what's your deadline?
They haven't said that. part
Okay, so-
yet, but, you
So
know.
nothing's gonna stop or not happen from it being waylaid? I'm just trying.
Well, you don't qualify for the incentives if we don't get it in ahead of time. They'll say we don't have enough time to review it. And so we're kind of within that 45-day period now.
When did the 45-day period begin?
Well, I mean, this now, the event will be in 45 days.
The bid is in 45 days.
So do we need to get this done I'm just trying to.
You can't do it tonight.
Oh, never
It's already
mind.
carrying the emergency clause.
Never mind, ignore me.
I just wanted to ask him, do you just need a copy of the resolution?
I wasn't sure if it was like on a first,
Yes.
second.
Okay. I'll take
Signed
care of that.
resolution?
Yeah. I'll take
Okay.
care of it.
Yes.
Okay.
She can get that to you.
I know. Okay.
Let me know.
Appreciate your support.
Thank you.
Thank you.
Agenda item number 10, ordinance amending the Tulsa Revised Ordinance Title 5, Board Commissions and Committees, Chapter 5, Greater Tulsa Area Indian Affairs Commission, reorganizing the readability, restructuring commission appointees and terms, providing for the tribal delegates from the Muskogee Creek Nation, the Cherokee Nation, and the Osage Nation, providing that the City of Tulsa's Director of Tribal Policy and Partnerships or similar position in the absence thereof shall be an ex officio, non-voting member of the commission. Who was, okay.
I'm Daniel Carter, the Vice Chair of the Greater Tulsa Area Indian Affairs Commission. I've been working with City of Tulsa on this proposed amendment to the ordinance for over a year, and I'm just here to answer any questions and encourage your vote and support passing it.
Questions or comments? Thank you. Agenda item number 11, ordinance amending the Tulsa Revised Ordinance Title 35, Infrastructure Development by amending Chapter 2, Infrastructure Development Permits, Section 200, Definitions, and amending Section 202, Contracts, Bonds, and Insurance, to eliminate the requirement for filing the certificate of formal acceptance in the office of the county clerk. Agenda item number 11, who's here for that? Come on up.
Sorry, Michael Lane sent me in here and I did not know.
At the
about
last
this.
minute,
Yeah.
come on up. Tell us who you are and.
My name is Laura Ferguson and I work in the infrastructure department here with the city. And formal acceptance is part of my job. So, what that is formal acceptance is when, the developer of the infrastructure basically signs over the infrastructure to the city of Tulsa. The city of Tulsa then takes over the responsibilities for that infrastructure. So what we're doing is we are just removing the requirement to file the paperwork with the county clerk, as our legal department has determined that there's no need for that.
All right. Questions or comments, anybody? Thank you.
Thank you.
Thank you.
Welcome to 4-4 for meetings. Agenda item number 12, license agreement between the City of Tulsa and Salina Spavinal Telephone Company for property located at 4330 Road, 160 feet north of Cripple Creek, Pryor, Oklahoma. That's an address for you, isn't it? To install a 4-inch PVC duct and fiber optic line underneath raw water flowliness. Mays County. All right. This is a new one.
Paul Zachary, Public Works. Our flow lines, we have about 150, 200-foot swath of land all the way out to Lake Spavinal and to Lake Uchee. And we routinely have buried utilities and things like that that are wanting to go under our lines, and we have a set program for how deep they have to be. And what we get is we get conduit basically from edge of our right-of-way to the edge right-of-way to edge right-of-way. And they have to bore and go underneath. So our flow lines are protected. We're about 6 feet below the bottom of the pipes. And these are frequent flyers with us. They normally do put in these lines like this. And we're having a similar one on an adjacent section line road here just on the next issue. But with this, all this information is provided to not only representatives of the authorities, boards, and commissions, but the TMUA as well. They're aware of things like this, and nobody offered any objection, Water and Sewer Department or TMUA. So we would recommend approval of this license agreement for the phone company.
Phone company. Questions or comments? Thank you.
Yes, ma'am.
Number 13, license agreement between the city of, oh, I'm sorry.
No, that's
No,
the
same one,
Yeah.
okay, started out the same. License agreement between the city of Tulsa and Salina, Okies do pronounce it Salina, don't they? Not Selena. Salina Spavinal Telephone Company for property located at 425 feet north of driveway to 3456 South 432nd Road, Pryor, Oklahoma, to install a 4-inch PVC duct and fiber optic line underneath raw water flowiness, Mays County.
Yes, ma'am. This is the same as the other item. It's just on a parallel roadway on South 432 Road. The previous one was on South 433 Road. Same situation. They just need to bore underneath, and we will have staff out there witnessing while they're doing this and ensure that they do not touch either one of our 72 or our 60-inch flow lines that go across these properties.
All right, so we won't have any backups, huh? Agenda item number 14, license agreement between the city of Tulsa and Kendall Whittier Main Street, Inc. to install decorative gateway markers in city of Tulsa's right-of-way in various locations across the Kendall Whittier district. Mr. One.
Yes, ma'am. We did receive an application for installing decorative gateway markers on city-owned land along the borders of the Kendall Whittier district. Within the backup of the packet, it does show the details of the various locations with photos and everything that we've taken of these locations. We did route this to the 30-plus right-of-way occupants, and we received no objections. And also the terms of the agreement, the license agreements are very similar to this, that if we need to have them moved or they need to be relocated as part of a utility work, they will do so, and it will be at no cost to the citizens of the city of Tulsa. But all these site locations we looked at and screened and have no objections and would recommend your approval of this agreement.
Pretty cool signs.
Yeah.
How, are they 6 feet tall?
It should be taller than that, I think.
Cool. It's in the sign.
Yeah,
Sign
the
itself
actual,
is in the back of material, if anybody
Yeah,
wants to take a look at it.
Yeah, 6 foot max.
Max.
the pole portion and then the sign is actually 10 feet on top of that.
Oh,
Okay?
that's gonna be a big, okay, thank you.
Yes.
Agenda item 15. Change order number 1 to contract number 137527 between the city of Tulsa and Magnum Construction, Inc. for project number 146120 in the amount of $43,829.48 and adding 185 days, calendar days for the addition of ballistic upgrades for a door, frames, and hardware for the Gilcrease Division for Tulsa Police Department, Union Division renovations, Gilcrease and Riverside Division. Mr.
Yes,
Vaughn.
yes, ma'am. This came up during the project that the police department would really have preferred to have these ballistic upgrades to these doors and frames hardware in these particular locations. And the large reason for the time extension is the advanced getting these things ordered and getting them here. It's not necessarily the install as much as it is the lead time in getting this stuff here. So with this represents 1.96% of a change order out of a $2.2 million contract. And we would recommend approval of this to meet the job requirements and performance requirements of these doors.
Ballistic upgrades for a door. Does that mean they're bulletproof?
Yes,
I'm
ma'am.
just kidding.
Yes.
Oh, it does?
Yeah, that's
Oh,
ballistic,
shit.
yeah.
I was just kidding. Okay.
Little
Those
gun
doors seem like they're ballistic proof already.
Or just,
It is school
might
door.
be some explosions
Of course they
and
are,
things like
it is
that.
an old school.
It is an old school, yeah.
Yep.
All right, agenda item 16, resolution authorizing condemnation of property owned by Kevin Lamb and Bernadette Lamb located at 4155 South Zunis Avenue, parcel 12A, Bullwood Acres addition and existing public necessity requires the acquisition of a sanitary sewer easement for 46th Street and Lewis Avenue, unsewered area. Contract 2, Area 2, in Council District 9.
Yes, ma'am. We're trying to get sanitary sewer into this area, and we've identified the parcel. We have presented it to the property owner, who then brought in his attorney, and we have been working with them now for over 5 months, waiting for response. And we are not getting any response from the actual counteroffer or anything like that, but we are hoping to construct the project this summer. And due to the non-agreement, just because we have not heard any response and we can't get them to respond, we need to move forward with the project. So we're asking for a little help from the courts.
Questions or comments? She said,
Well, okay. So you've reached out to them and they haven't returned the call? I mean, that whole neighborhood wants to get this updated. I know.
Yes, ma'am. No.
He said, yeah.
In the packet, we give a detail of our conversations and our dates, and it is one of the same attorneys we were dealing with the power lines.
Oh, fascinating.
Yes.
Thank you.
Consistent.
Got it. Got it.
Okay.
Thanks.
Good?
Yep.
All right. Agenda item number 17, presentation by representatives from Healthy Minds Policy Initiative on recent assessment of substance use disorder treatment gaps and opportunities for improvement in Tulsa County. Councilor Bellis brought this agenda item to us.
And I'm just glad to help. Apparently, no. I'm just glad that Healthy Minds is here to share with us. You know, I especially when we've seen so much instability in the funding landscape and the policy landscape in the mental health space. So I'm really glad that we have Healthy Minds that can kind of advise us on the kind of state of our community when it comes to these needs, and then what we could do going forward as we are mindful of this is a kind of piece of the puzzle when it comes to our homelessness, housing, mental health crisis, and of course they have a really beautiful needs assessment that we.
Did you send that to us?
Yeah, he definitely.
Yeah.
Yeah, that's where I was like, now talk about what we should do with it. It was my I was like, give us homework related to the reading. Is what I thought. So I'll just pass it over to Healthy Minds. They have a beautiful presentation.
Perfect.
All right, let's go.
Council, let's make sure I appreciate it. And thank you, Councilor Bellis, we really appreciate the invite to do this. Yeah, so we'll go through just a brief high-level overview, just as a reminder. I know you all received this report. Just a reminder of what it said, and happy to talk about what it means for the city and implications here. In background, Healthy Minds was hired by the Tulsa County Board of Commissioners because they wanted to spend their opioid money appropriately. And they wanted to take politics out of the process, and they wanted to put data in the program. And so they requested that we as an organization, if you're not familiar with Healthy Minds, I'll give you an update here in a minute, that we provide some sort of both qualitative analysis of what the community wants, what it sees as the gaps and the needs, as well as quantitative analysis. And a lot of quantitative data went into this, from claims data to public safety information and data, as we boil down to some recommendations for pathways that the county could take for investing. As I mentioned, Healthy Minds Policy Initiative, we are an organization that is a nonprofit dedicated to transforming mental health outcomes in Oklahoma. The way that we do that, though, is really to partner with counties, cities, the state, and local governments and leaders to provide assistance to accomplish the goals that we all share, which is improving the lives of our residents. So I am Zach Stoigop, President and CEO of Healthy Minds. I have my colleague here, Dr. Shannon Dial, who will introduce herself in a moment, and we'll go through briefly here what we found. Just a little bit of in context, this chart is showing you the population increase expected in Tulsa County. We have about 22% of our residents, about 100,000, have a substance use disorder, and about 6.6% have a serious mental illness that is significant enough to really have consequences in their daily functioning. Unfortunately, we have about 77% of our 100,000 residents with a substance use disorder do not receive treatment that they need. So if you do some quick back of the napkin math, that's about 77,000 in Tulsa County. So really unfortunate numbers there. As we dive into this a little bit, first we want to look at where the need is in the county. And the map that you're seeing here is a composite of data from the U.S. Census Bureau derived information called the Social Vulnerability Index. There are 4 large categories that are compiled here. For example, housing instability, membership in a historically disadvantaged community, poverty status, transportation ability, and food insecurity. Things like that are included in this map. And what this shows us is that there are areas of our community, of course, that are more vulnerable, we believe, to mental health and public health crises than other areas of our community. This is a sort of a bird's eye view of where we think approximate need is in our community. And by the way, these measures are also used historically by city planners and emergency planners to determine areas of communities that are more prone to disasters. So as we're doing disaster planning, this is a very similar measure that is used. So we wanted to look at this because we wanted to compare where the services are, and we wanted to look at the zip code level access to those services. And we found that there are some mismatches here. And one area that there's mismatches is in the location of the providers. So the blue dots are our CCBHC, Certified Community Behavioral Health Clinics. If you're familiar with that term, these are public mental health providers who are safety net services, certified by the state to provide a broad spectrum of services that really no other provider does offer, from therapy all the way through to team-based services and care, home-based services, things like that. These providers are charged with serving communities regardless of ability to pay, so they are very important to this conversation. So
Say the name again.
CCBHCs.
Well, I see the abbreviation. What is it?
Certified Community Behavioral Health Clinics. And in
Behavioral health
Tulsa
clinics.
County, there's
Certified,
four.
okay.
Family and Children's Services, Creoaks, Grand, and Counseling and Recovery Services.
Okay.
And then similar, the CCARCs are that, but for addiction, substance use disorder. So the dots here are not largely located in the areas of highest need.
Yeah, that makes
and
sense.
so you can see those zip codes here that are the highest, starting with 74110, which I believe is the highest, Shannon, in the state. Is that true?
Yes.
In my district.
In the
Yes.
state?
These are the top 5 highest in Tulsa County, and if you look at the percentile, 99.39, that means that 99.39% of the zip codes in Oklahoma are lower vulnerability than that zip code.
So this
for-
is from
Congratulations.
statewide.
Statewide.
That's
So-
not the highest, but it's number
Yeah.
2 or something like that.
Right.
Really close.
Right, very, very close to 100. 100 would be that 100% of the zip codes in the state are less vulnerable than your 74110, 74115 here in Tulsa County.
So we looked at the location of providers and we found a little bit of a mismatch. When we looked at the Medicaid claims data, we also found a mismatch in terms of whether these people in these communities are accessing the services they need. Fewer people per capita are accessing services from these zip codes largely than other areas of town, which is interesting. Here's another way of looking at
Is
some
it
of the
when-
access challenges.
The services aren't in the community,
Exactly.
so yeah, they're not accessing.
That's exactly right.
That's what, yeah, these images just show it so clearly, right? And when you think about transportation to get to these,
Yeah,
It's impossible.
right?
the disparity's huge.
So these maps are showing you on the left
Overlay
a 15-minute drive time to one of these dots, and on the right, a 30-minute public transit trip to one of these dots. No surprise there. I'm going to pass it to Shannon, if you wouldn't mind, Dr. Dow, doing a quick intro, and then we're going to go through some of our findings.
Hi, you guys. Dr. Shannon Dial. I work for Healthy Minds, and I'm a licensed mental health professional. I was one of the lead researchers on this project and have really enjoyed all that I've been able to find out through this project and learn more about our community, and I hope to share that with you guys today in easy to understand detail. One thing I wanted to add about the Social Vulnerability Index is that we did it at the zip code level, and it's even able to be pared down to the census tract. So if your zip code for your district was one of these, we could actually help you or show you how you can go down to the exact census tract that is the most vulnerable census tracts within your zip code. It is fascinating. All my colleagues tell me that I'm going to get a Social Vulnerability Index tattoo because the tool is so fascinating, and it's available for everybody to use, and it has just provided a wealth of information about our community.
What
So,
is that, the tool?
the CDC Social Vulnerability Index, if you Google it, it's really easy, and just as a tidbit, when you look at the map and look at the tool, if you zoom to level 8, that opens up the zip code and census tract availability for you to look at the zip codes in your area and to see where they fall in the Social Vulnerability Index. So I wanted to share another key finding that we had in our assessment, and that is that in our community, the substance use problems have evolved, and I think one thing that was most surprising to us is that the overdose death rates in our community involved multiple drugs. We call that polysubstance use. That is through looking at ME data. It was very rare that somebody died from overdose from one drug. And we found both quantitatively and qualitatively in our discussions with our community members that methamphetamine is a huge concern. There's a lot of talk about opioids and there's a lot of talk about opioid dollars, but we want to be mindful that methamphetamine is still at the front of everybody's mind and still at the front of treatment needs. And it adds a lot of complexity when methamphetamine is combined with opioids, and we're seeing a great deal of that. We're going to talk a little bit more in a minute about medication for opioid use disorder. It's called MOUD. Before it's been called medication-assisted treatment. I'll talk about that a little bit more. But I wanted to note this figure for you here on this slide. And this is the overdose death rates by drug for Tulsa County. It's hopeful that these rates are declining, but one thing that I wanted to mention about our community is that Tulsa County, despite declining rates in overdose, and this is statewide as well, Tulsa County is notably higher in their overdose death rates than Oklahoma County and the state averages overall. As you guys know, Tulsa is smaller than Oklahoma City, Tulsa County is smaller than Oklahoma County. And so that was something notable that we saw throughout the statistics that we measured in this project. And in the report, there's a lot of comparisons to Oklahoma County, just because we wanted you guys just to be able to see where that compared to somebody near to you. But there were notable and drastic differences between Tulsa County and Oklahoma County, and they were always notably higher here in Tulsa County. So I just wanted to mention that to you guys.
Why?
I don't know. I'm not, what do you think, Zach?
That's a complex question.
We get asked that a lot.
We get asked that a lot. We don't have a good answer as a long and short of that. There's potentially, I don't want to, maybe we can talk offline about, there's not enough concreteness here for me to respond probably right here on that. But
Okay.
we could get into it.
Never mind, I was about to speculate related to like mimetic historical trauma, but
Yes.
I don't.
Yeah, I mean, in terms of what plays into drug use, trauma historically plays into drug use. We have a history in
Social
Tulsa
disadvantages.
Yeah.
of, in particular, some of the most impactful drugs being methamphetamine. I started my career, as some of you know, as a 5 a.m. beat reporter at the Tulsa World, listening to the police scanner. And that was back in the days when we were cooking meth. And every morning there would be a meth fire that we would go out to. We don't see that anymore. The reason we don't see that anymore is because of the changes in laws at the state level that have made the ingredients harder to get. We are now importing it from Mexico. So it is stronger, more available, and the market is here. And so this is actually one of the, I think methamphetamine, and Shannon mentioned this, is still the top drug of concern for us. Even though fentanyl and some other issues are emerging, methamphetamine is really the core of what's happening in Tulsa County. There was a New York Times report, I think it was on the front page, in 2020, I believe, that cited Tulsa as a methamphetamine hotspot in the nation. That story really spurred a lot of interest, and as a result of that story, Healthy Minds started the Tulsa Methamphetamine Coalition that has since become the official advisory board of some of the city's work, as was mentioned by a previous presenter. And that work has resulted in a few things. Number one, new treatment pathways, Narcan distribution at the fire departments, local contingency management programs, which is the most evidence-based, best practice, gold standard approach for addressing methamphetamine. It is 2 to 3 times more effective than standard treatments. We're doing it in Tulsa as a result of that work. It's kind of under the radar, but pilots at Grand and Family and Children's Services. And there has been a new wave of, I think we did a big assessment planning process with this group over the last few months that's going to result in a new wave of strategies for addressing methamphetamine. So some of this downward trend, I think there has been some good work happening in Tulsa. The downward trend is a national trend as well. But Oklahoma had the highest year-over-year decrease in overdose deaths. So we are doing some things here that are good. Yeah.
I just wondered if also income, if the income standards are higher in Oklahoma City versus in Tulsa, and that also leads to disparities in poverty, if that's also part of the equation of why it's higher in Tulsa.
Yeah, and it's such a great point, because, you know, remember we talked about the most vulnerable zip codes? And our next slide will show you when we looked at overdose deaths in those zip codes specifically. Does anybody have the next slide?
Yeah.
Thanks. So what we did is we looked at the zip codes with the highest overdose death rates in our community. And this is from the medical examiner data. We kind of color coded that. You can see those with the lines did not have enough deaths to kind of meet being able to be captured. Now I want also to tell you.
Is that by residence or where it occurs?
Good question, you guys. This is for this data only. This is the death that occurred in the zip code and not in the hospital.
Right.
So anybody that was found,
Like wherever they physically were.
Were
Okay,
when
I
they-
just wanted to
Right.
check based on like
That's
compared to
right.
where they
Address.
might live. Yeah.
right?
So they
when
may
we
not live
when
where
we
this is
looked
occurring.
at deaths in the zip code specifically, you can see that this is over a 4-year time period. 74115 in our community, which if you remember was also on the high SVI list. 74115 had the highest, and this look at the data from the Oklahoma State Department of Health and the medical examiner data.
That's our district.
Yeah.
So to your point about vulnerable zip codes, what determined those vulnerable zip codes is race, housing, those kinds of things, and you can see a direct potential correlation to overdose deaths and drug use. It's very interesting.
Our neighborhood condition index data also supports that.
Wow.
So
Yeah.
it doesn't support the idea of drug use so much as it does equity in a scale of 0 to 5, and where it's rates in employment and parks and education.
Social determinants
Yes.
of health.
Right.
Yes. One thing we're doing in Oklahoma County is looking at these zip codes with these high zip codes with a really intentional focus and doing some specific work in these high need zip codes. It's really fascinating when you look at how much need is in these high zip codes and how these data points continually point us back to these vulnerable areas. Next slide. As I mentioned before, we were talking about MOUD, or medications for opioid use disorder, which is the gold standard treatment. It is a pharmacological intervention to help people with withdrawal and craving. We were very, very excited about the progress that Tulsa is making in the number of people enrolled or had at least one visit for an MOUD appointment. We pulled the largest providers of MOUD here in Tulsa County, and we found that almost half, if you could see, that we estimate that about 15,000 people in our community are estimated to have opioid use disorder. And we found through the self-report of our organizations that they had seen at least 7,000 unique individuals for at least one appointment for MOUD, which is excellent. And to tell you guys how great this was to see this at about 50%. In Oklahoma County, we found less than 1,000 to be being served for MOUD by their largest providers. And so this
4%.
is
Based on what number?
4% compared to 50, yeah.
Say that again, I'm sorry.
4% being seen in Oklahoma County and 50% being seen in Tulsa County.
Close to 50. So
and
we're
then
doing a lot better than Oklahoma County in this regard.
We also looked at this and used a very interesting tool called the WISIP tool. It's out of the University of Washington. And they estimated that if all of our citizens in Tulsa County that needed to receive MOUD, engaged in MOUD, the city could realize over a $50 million financial impact of that service engagement and that targeted intervention, which we thought was amazing. When asked why more people don't engage with MOUD, it usually has to do with transportation. In the beginning of MOUD, patients usually have to go multiple times a week for dosing. And so it's really hard, and oftentimes the availability of those appointments are only between 8 and 5. Something that is a possibility is long-acting injectables, which allows people to have to attend less visits, but that medication is very, very expensive.
Just one quick point on this. Have to say that we're all aware of the funding cuts coming from the Department of Mental Health. Those have impacted substance use providers in particular, so we don't expect this number to improve in the coming years.
It's getting worse.
It would get worse.
Yeah, say it's gonna get worse.
Yeah, so I was just wondering, thank you. In the statistics here, How many, excuse me, how many, or if it's even counted, of these individuals are unsheltered?
That would be a demographic we could ask them to break it down by housing status. But it's a good point, because when we asked if anybody had mobile
Right.
MOUD to
That's
meet
what-
people in the homeless community, very few said that was a possibility for them at this time, but would be interested in being able to do that in the
Right,
future.
that's when you mentioned transportation, that's the
That's
first thing I
right.
thought of. And even so, I mean, how would that affect the outcome of the zip code data that we're getting?
It would decrease the overdoses, most likely.
Interesting. Well, and it also shows a focus where possibly unsheltered needs really are greater.
That's right.
Accessibility to resources.
Yes, and thank you, because all of the people we talked to in our community, when we talked about, kind of what is your biggest concern about people's engagement with treatment, and everybody said it's their basic needs aren't met. They can't move on to worry about treatment when they're hungry and cold. In fact, an interesting story is somebody shared with us who is unhoused that they actually used their drugs as a protective mechanism to keep them awake,
Oh, yeah.
to keep them safe, and so I thought
Well,
that was a very
it's a
powerful
form
story.
of bartering as well.
That's right.
I mean, it's a way for them to have something of value that they can trade with somebody else.
Next slide. One thing that was surprising to me about our community and talking to our interviewees for this project and our key stakeholders was how many people said they had difficulty getting naloxone. If you're familiar, naloxone is the nasal spray. A kit has 2 doses. Even the fire department expressed immense difficulty being able to get naloxone. I will say that since we did this work, there's been a lot of opioid funding and a lot of grants approved, and so I would assume that a lot of people have been trying to write naloxone into their grants. But when we looked at the numbers, yes?
No, finish your sentence.
Oh, okay, that's okay.
If I have a question once, yeah.
When we estimated that about 15,000 kids would basically meet the need, but obviously we want more than that in our communities. And what we found is that the state, the Department of Mental Health, had given about 45,000 kids to Tulsa County, but over 23,000 of those kids went to the CCBHCs, the Certified Community Behavioral Health Centers. But to have basic entities like fire and some of the homeless shelters and some of the youth shelters not know where they could get naloxone or have to buy it themselves because it wasn't available through a free avenue. That was concerning to me because it seems like over the past years that this has been available everywhere. When asked about if it's available to those incarcerated or discharging from jail, it seemed like it was available to them, but it was optional for them to pick it up out of a basket. It wasn't really, it wasn't really matched with education, but there was some in the jail, but it does have an expiration date too, so there has to be a strategic plan with naloxone distribution.
That's what I was gonna ask, is if there's any, especially maybe from the cost perspective too, like coordinated community bulk purchasing. Cause, I see this a lot, working in a different medical space, but where, you go to do bulk purchasing, and if there has to be like a, specific physician or healthcare provider that signs on across entities, that's hard to share, but since this doesn't have to be disseminated by like a licensed physician, right? In that case, then, that kind of opens it up to coordinated bulk purchasing, potentially, but I understand that could be pretty complicated with all these different agencies, or I wouldn't know who the right central hub of that would be, but I could
My
imagine.
understanding is the Department of Mental Health has multiple companies that they have an arrangement with and can connect people to.
Right.
And so they recommend and have vetted those companies available to people that have the money for those.
I would just be curious that, like, more broadly though, across the whole system, instead of different agencies or entities doing that purchasing, if you could have one that could get, like, really, usually the more you buy in these medical
Oh, and
spaces,
then
like,
disperse, yeah.
and it really lowers the cost per unit in a pretty efficient way. I'm just naming that as, I'd be curious what I don't know, maybe it's you guys, who like the best neutral convener of coordinating that is, but there could be some real, both cost savings and making sure someone's the right hub to get that out to all those more direct community providers instead of them being stuck somewhere.
Moving on to our third key finding, and that is that Tulsa County can divert more people away from the criminal legal system into treatment and save tons and tons of money for our community. When we looked at our relationships and our conversations with those in the jail, including the sheriff, we understood that there's an immense need for treatment and mental health services in jail. We were encouraged by the amount of MOUD care and counseling happening in the jail, but the sheriff did say that there had been multiple overdoses, and while many of those inmates had been saved, the frequency of those overdoses seemed immense. When we...
In the jail?
Yes.
So they were high when they went in, or are they getting it?
In the jail. Yeah.
They're getting meth in the jail?
Getting drugs in the jail. And so because of that, to your point, what we found, again, to that naloxone, when people leave, sometimes people are actively using in jail or aren't fully detoxed or are detoxing in jail. And so we believe that a robust education and naloxone program in the jail as people transition from the jail into the community would be very important. As I'm sure you guys know, some people go in at high rates of use, stay in jail for 30 or 60 days and come out and then use the same amount as before they went in, and oftentimes that can be a deadly impact. And so just to think about, just to put a pinpoint in your mind, we talked about transition from jail to the community, but transition from ER to the community is also a really, really risky time. So that would be another time where people need to be monitored, tracked, given naloxone, checked on. Instead of just saying, call this place on Monday, they're given an actual appointment and said, hi, you have an 8 o'clock with Shannon on Monday. And that's very different than often what we see in our communities, is that somebody just says, call one of these places on
And
Monday.
get signed up.
Yeah. Yes, ma'am.
So we would need then facilities where people could actually go with beds and monitoring situations, rehab type programs where they could stay.
And I believe Oklahoma County is building a place like this.
Medical respite center.
It's like a diversion,
Oh.
a diversion
Right,
connected.
okay, right.
It's a diversion center connected to the jail, and people can be triaged, who are determined to meet appropriate need to be treated in this mental health center. I think it's gonna have up to 60 beds potentially.
Oh, wow.
And that is kind of literally a diversion to this door instead of this door to jail, which I think is a great model. I believe it's a MAPS project.
Like attaching Grand to the jail?
Similar, yeah.
Okay.
Well, they already do that with
That
alcohol
piece.
now. I mean, the sobering center, we have something like that now.
But it's not attached to the jail.
Yeah, it's not.
Right.
The proximity.
Mhm.
Okay,
There's
sorry.
models called critical time intervention as well that can go and deliver some sort of mobile care in that way. But
So the program they're building in Oklahoma City is next door to the jail?
That's right.
Wow.
That's right.
Well, they're building a brand new jail for $1 billion or something like that. It's a big
Part of
number.
their maps.
Well,
Yeah.
they bring in a jail because I got
Next
sued.
Yeah, they did.
And finally, our fourth finding had to do with children and youth in this community. While we found in the data that the Oklahoma Prevention Needs Assessment showed that youth reported a reduced use in alcohol and marijuana, that was somewhat opposite of what the principals and the teachers in the schools were saying. And that is,
I bet.
that is that they were overwhelmed by marijuana and vape difficulties in their schools and presence in their schools, and had immense difficulty engaging with parents oftentimes about vape use.
Is this
And
YRBSS data?
this is Oklahoma Prevention Needs Assessment. It's given every 2 years for 6, 8, 10, 12.
Is that what folds into YRBSS? Or?
it's a separate.
It's totally separate. Okay, I wasn't sure of it.
You
So
said
that's going to
16.
continue happening, this data?
Uh-huh.
Okay.
You said 6, 10, and 12?
6, 8, 10, 12 every 2 years.
Aren't the vaping laws kind of loosey-goosey?
Yes.
I mean, to buy cigarettes now, you have to be a certain age, right? Is it 18, 21?
18.
But vaping, the law, I mean, you can walk into a smoke shop and buy vapes at 13?
It seemed like the most common report was that children were receiving them from their parents or older siblings.
Yeah.
But I have heard that stores are pretty lenient. So just one finding at the time of our assessment was that only 4 of the 23 school districts in Tulsa County had received, at this time, had received money for prevention and upstream prevention, which we believe is essential to diverting youth into more healthy coping factors than the use of substances. We found that even though the data showed that fewer youth were using alcohol and marijuana, the risk factors still seem very high, which would put our youth at high risk of engaging in early substance use or as a gateway to later adult, more intense use of substances. And so based on these findings, Healthy Minds identified 5 key areas for improvement for Tulsa County. Aligning the substance use services with the changing trends in our community, addressing the unmet needs in those vulnerable zip codes, diverting people away from the legal system, and making those high-risk transitions like out of the ER and jail a lot safer, preventing behavioral health problems among youth, and I'll let Zach tell you guys how Tulsa County used our assessment.
You were more involved in the process than I was. So they did issue $4.5 million in opioid settlement grants that were granted directly to the county through their settlements. But do anticipate the county will use this to both go after AG funds through those opioid settlement dollars, and as those dollars come in directly to the county over time to use this assessment moving forward. But these recommendations were used initially to give these $4.5 million out.
So, I mean, so these key areas of improvement, I mean, I think for me, it would be helpful, because these are like more general statements. What specifically can the city and those of us around this table, what could we do, activities, ideas, suggestions, as far as specific ideas can we implement?
Policy, can we put together?
Policy, funding of various programs, and different areas, whether it's schools, whether, all of these entities that make up a community of people. What would a strategic plan look like in that regard, specifically? Right?
So, yeah.
Would be helpful. I'm not saying it's your job. Apply for a grant to come up with it. But
And part of that is the Methamphetamine Coalition doing in the last 3 months, this planning that we've been doing, will come out with the next phase of that work. And so we'll have some really specific things that are vetted by those who are working in this space.
Okay.
And so that's number one, but a few things I will point to. Prevention dollars in schools don't grow on trees. There's no way to bill for prevention services, but we can really truly prevent 60 to 70% of these things from happening. And there is no way to fund it other than federal block grant dollars, local philanthropic grants, and things like that. And so to the extent that, we can look at any partnerships there, I believe the opioid grant that you all just discussed includes some prevention services or TPS, which is a good thing. Another thing I would point to is the mental health crisis system is a really important diversion tool, and if I'm the city, I'm looking at those dollars coming in through the jail, through our police force, the manpower extenders that really help utilize public safety dollars better. That is working in Tulsa right now, today. It's not perfect, but it is working. We've seen, I just looked at the numbers, so forgive me for being a little bit vague, but about 6,000 to 7,000, I believe, police diversions in the last year because of COPES being embedded 24/7 at the 911 center. So we're not even calling police out to these calls anymore. They're able to kind of go and do their jobs, which is enforcing the law, instead of being a clinician. And the clinicians are able to take those folks and get them help. And a lot of those have substance use disorder. In fact, I think more than half, last time I looked at the data, of the crisis center admits in Tulsa are related to substance use disorder and methamphetamine in specific. And so that's a big overlap there. A lot of work is happening through the First Responder Advisory Council on that right now. So we've actually just hit the first full year of implementation of this in March. So we'll be looking at doing some data and letting you all know and kind of what's going on there and talking about a next phase of that work soon. But exciting work there, and I think there's a dollar figure associated with what the city has saved from that, but I don't recall off the top of my head. I wasn't prepared to talk about that, sorry. But it really is working, so doubling down on that, there will be a funding need to continue in expanding that work. And part of that is because if you call 911 and say you need police, you now get diverted through a call matrix and an evidence-based tiered approach determining what is the violence risk and who needs to go out. But if you say medical or another issue, you don't go through that triage model. So there's a whole area of our 911 center that is not associated with that yet, but that's the next phase of the work.
And I would just add that, you know, you guys will hear about further opioid money like you did today, and there will be renewals of that money, and I think that you guys are poised in a great position to point people to things that we have spent money on here in our community to find out the gaps and the holes, and so aligning that funding to these specific areas is so important. And those opioid dollars are for a long time, and so we've done the work to identify the gaps, and so let's put the money to match the gaps. I think is important.
So,
Much like where the locations of services are, yeah.
yeah, I mean,
It's not happening.
these, I mean, 3 of the zip codes are in District 1, and the highest ones are District 3 predominantly, shared with District 6.
Mine was on there too. Simple
Yeah,
136.
yes, you're right, you're right.
Yeah,
My
which
bad,
is
sorry.
ours.
Ours, yep.
Is there a link to the 16 organizations that received this money?
Yes.
Oh, okay.
County
So
website.
The county website?
Right.
The press release, yeah.
Yeah, okay.
And just to applaud the county, what was so great, as Zach mentioned, they awarded based on our work here. They actually took each key area or key finding and matched the award to that section of this assessment, which was so cool. It's really a great way of, again, pairing the need with the dollars that we've received in our community.
And that's on the
So
website?
informative.
Yes.
Gosh,
You're saying that's on the
thank you.
website, okay.
Thank you
Yes.
for coming today.
Yes,
So
yes.
informative.
Well, those opioid settlement dollars, as we know, are a once-in-a-lifetime generational opportunity to abate a crisis that happened and truly impacted every layer and strata of our community. If we don't get that right, we will have passed up a massive opportunity. I know that local jurisdictions are often met by folks holding their hand out saying we're doing good work, and there's no argument that there's a lot of good work going on. But what we are hoping and encouraging is any local jurisdiction to look at the need relative to the community need and make sure those dollars are meeting a community need that will move a needle somewhere in our community and not just a good program that sounds good. It's not a comment on how Tulsa is using its dollars, just a philosophical comment generally.
Any other questions or comments? All right, well, thank you so much.
Thank you.
Thank you both. That was so informative.
Yeah, a lot of good work.
Thank you.
We adjourn.